Thank you. So yeah, that was a title that was given to me to talk about science, politics, and citizens' activism achieving results. So let's have a look at the results we have achieved. So we have the TPD Article 20. I hope you're all a little bit familiar with that. That is the European regulations on electronic cigarettes. Across the pond we have the FDA deeming regulations. Recently, I think it was a week and a half ago, there was a new paper released by the World Health Organization Framework Convention of Tobacco Control. They do not call it e-cigs or vapors, they call it ENDS or something like that. Nobody uses that word. If you look at all of them, you would say we haven't achieved nothing. We have achieved big failure because all those regulations are crap. But there is still a but, we did achieve something. When it all started, and that was about in 2012, the regulations started, everybody was lobbying to impose a blanket ban through medical regulations, to impose medical regulations on e-cigarettes so there would not be one single one on the market. We avoided that by going to the European Parliament. I think that was our first and our biggest success, to convince European Parliament not to go for that and to put something else in place. Unfortunately, what came in place is not much better. What else did we achieve? Well, when I started vaping, that was back in 2007, we were only a handful on this planet who vaped, but we did find each other on social networks, so we talked about it. And we immediately felt that vaping was under threat by public health. Public health didn't like it. One of our goals was to make sure that every smoker on this planet heard about electronic cigarettes. So get the genie out of the bottle, so a blanket ban could not be imposed. And that we achieved. With all the bad publicity and all the sensation seeking in the press by public health, I think you must have lived on another planet not to have heard about e-cigarettes nowadays. So that we can tick off the list. Bad publicity is publicity as well. The genie is out of the bottle. Putting a blanket ban, I think, in any country on the world will not work. Another thing we have achieved, and that was to our biggest surprise, that a group of scientists and public health authorities, they started to talk pro-vaping. That came to a complete surprise. And they started to debunk the usual junk science that public health is producing on any subject that is tobacco related. So that is another achievement, and let's go on from there. So let's have a little closer look to those regulations. So in the US you have the FDA deeming regs. It really could not get worse than that. It's 500 pages, restrictions. At the end, only the first generation cigarettes that are produced by big tobacco are allowed. They are the only one who have the money and the means to comply with those regulations, and all the rest will be off the market. That is basically it. There is still a shimmer of hope because there is a serious legal challenge to the FDA deeming regulations. So I'm pretty positive and optimistic that it will result in something. There will be a softening of those regulations, in my opinion, due to the legal challenge, but they will not wipe the complete FDA regulations off the table. In Europe, the matter is a little bit different. So the European Parliament objected to a blanket ban, and the European Commission, they imposed something different. And basically, it is really transparent. They want to tax it. And the reason why they wanted a blanket ban becomes obvious as well. They were going to lose their taxation on tobacco, which is a lot of money. And in order to replace that, now they made a regulation that prepares for taxation on e-cigarettes. And the taxation is already announced by the European Commission. It will be in next year that the European taxation will be a fact. It's already decided upon. But in the TPD, in Article 20, there are a lot of loopholes that have deliberately put in there in order to ban whatever they do not like. And the European Commission, they do not like open systems that you can fill as a user with the liquid of your choice. The liquid of your choice meaning also an untaxable liquid. And they do not want that, so they want to get rid of all open systems. Their first attempt was with the SEN Commission, which is the European Commission like the British standards, but on a European level. And in the TPD, there is a little phrase that open systems, they need to have a refill mechanism for leak-free filling. So if as a user you fill your own cigarette with the liquid of your choice, it has to be leak-free. We anticipated this, and the French, they already have a standard in place, the AFNOR, which is the French-British Standards Commission, and they found a very bright way around it, saying that, okay, I have my vapor here, and I have my liquid bottle in my other bottle, so if the sprout of this liquid bottle is smaller than the filling hole, I can fill it without leaks. It's so obvious, you just have to think about it to put that in regulations. And this was adopted as well by the SEN Commission, but the SEN Commission, they added something, and they said, okay, the docking station, which is a term that has been introduced by Big Tobacco with their newest models, is also a system for leak-free filling. The only problem is that the docking stations that Big Tobacco are using, you can't refill them. No, then it's pretty easy to do it leak-free if you can't refill them. If you have to use the liquid that is already put into the factory of Big Tobacco and you can't put your own liquid in, well, okay, problem solved. And the European Commission, once they got the advice of the SEN Commission, they did send out the two propositions, so the bottle and the docking station of Big Tobacco, to all the member states and says, now you have to choose one of them. It's a multiple choice question. So the SEN and the vapors that are represented in the SEN and the vaping industry, which has representation in the SEN, they had to pull their weight to say it's not a multiple choice question, you have to accept both. So the first hurdle in getting rid of all the open systems, well, the European Commission failed. So there's another victory for us. Small victories, but we're getting there. But there's still another loopholes like that that are built into the TPD, like the 3 strikes you're out clause, which basically means that if 3 member states decide to ban a specific e-cigarette or a specific family of e-cigarettes, it automatically gets banned in all the 28 member states. And I'm still talking 28 because the Brexit is not a fact yet. So, and the European Commission is already moving for that. They published a report, which is absolutely no scientific at all. It doesn't have any scientific references to it, stating claims that if you spill a drop of liquid on your skin, it burns a hole in your hand. If you got a drop of liquid in your mouth, it burns a hole on your tongue. I've done it so many times. That is absolute bullshit. But they're already preparing on the 3 strikes you're out clause. If 3 member states believe that bullshit, all the open systems will be banned. And only systems where there is no spillage possible because they're closed will be allowed. On the FCTC document, I'm going to be very short of it, the only improvement that we have over the last one, which was for the COP6 in Moscow, that in the COP6 in Moscow, the WHO was pushing member states to put a blanket ban on e-cigarettes. And now they are no longer openly pushing for it, but every paragraph in that document states that, okay, every member state that didn't already put a blanket ban on it should do this. Every member state that didn't put a blanket ban on it should do that. There is some small improvements, but I'm really doing my best to see the some optimism in that document, because for all the rest, it's banning, restricting, and every time we do not have any scientific evidence to justify bans and restriction. That's what their reasoning is. But okay, I've been in this business, well, I'm not in a business, I'm just a consumer that is concerned about that product and who is passionate about that product, but in almost 10 years' time, it has become very obvious to me that it is not about health, it is about money, it is about taxation. Yeah. And tobacco harm reduction, it also equals tobacco income reduction. And that is a big problem. Just look at the list of attendees that are going to the COP. Well, the COP7, the list of attendees is not public yet, but look at the attendance at COP6 in Moscow. Most of the member states, the vast majority of the member states, are not sending a representative of the Ministry of Health, but of the Ministry of Finance. It's the finance ministers who are deciding in the World Health Organization what's going to happen to us. And finance ministers, they think, they talk money. And out of COP6 in the press conference, one of the biggest achievements the World Health Organization was so proud of that they made the first steps to introduce a global tax on tobacco. So, there we are, smokers. Big tobacco is entrapping smokers in order to make money out of them. It's their business. It's not shocking. Every business does that. Every business wants to make money out of its customers. So that's not strange. Big government is entrapping smokers as well for taxation purposes. Taxation has gone up to such a level they no longer can survive without it. When the European taxation on vaping was announced, the spokesperson of the European Council, he was pretty blunt about it. We need that taxation in order to make up the losses of tobacco taxation. We need a taxation on vaping. And if we do not get it, yeah, every member state in Europe will be in financial trouble, and such trouble that the weaker member states would face bankruptcy. That's the economic situation of tobacco. They do not want to get rid of it. They are dependent on it much more than smokers are. But the big surprise is that tobacco control, public health, is also paid with tobacco tax. They can't live without it either. They need the money as well. And within tobacco control, there is a big movement to keep smokers smoking because they deliver the money. And that is shocking. But for the first time, if we take snus out of the equation, that was back in the 80s, now we live in a completely different climate, but for the first time, smokers, they can be identified as a group, and you could smack a tax on them. And that is a game changer. You can't do that with nicotine patch users. You can't identify them as patch users or nicotine gum users, but vapors you can identify pretty easily. And this is the game changer, leading smokers from one entrapment into the next. But in the early days, talking back 2007, when we discovered the first electronic cigarettes, which were cigalikes, they looked like cigarettes, they had the size of a cigarette, they were pretty not well-designed products. It was a completely new product, and okay, every new technology, it has its defects, its child defects. But what was really strange, that it was the consumers who took it upon themselves to improve them. to the first people who used it, we were from different backgrounds. I'm an engineer, so the first time my electronic cigarette broke down, the first thing I did, I disassembled it to look how it works. And in my engineering mind, I said, I can do better. And I started building one. From scrap parts I did find in my house, on my kitchen table, I built electronic cigarettes that did work a lot better than the first design of Mr. Honlik. But that fun didn't last very long, because in 2008, on the COP3 of the World Health Organization, the blanket ban was announced on electronic cigarettes. So then we were more than motivated to get that technology to make it ours. So nobody could take it away from us. If we could make our own electronic cigarettes, they could ban whatever they wanted. We just would make them ourselves. And that is what happens. And actually, the second generation electronic cigarettes, it was designed by vapers, for vapers, and it empowers vapers to be civil disobedient to all those regulations that are imposed, and blanket bans and restrictions here on nicotine and this and that. On that, a side note on that, very recently, also a couple of weeks ago, Fontem, which is a big tobacco company, they actually produce electronic cigarettes, but I think it's Imperial Tobacco. They lost Honlik's initial patent on electronic cigarettes in European court. So the technology is in the public domain, legally. Another victory for us. So how did we do that to make that technology our own? So the first generation and the second generation and everything that builds on forward on the second generation up till today, there is a big difference in design philosophy. Honlik designed a cigarette to keep his clients in his company. And we designed it not to be chained to one company. We wanted the freedom of choice of what equipment and what liquids we used. So what did we do? In the beginning, all the Chinese manufacturers that copied Honlik's initial design, they had all their proprietary threading. So, an electronic cigarette basically consists of a battery and an atomizer. They screw together. And every manufacturer had their proprietary threading, so you could not use the batteries of one manufacturer with the atomizers of another manufacturer. What did we do? We made little adapters with the threading of brand A and the threading of brand B on the other side, and we could switch atomizers and batteries as we pleased. So we forced the whole market to adapt an industry standard, which is the 510 threading, ego threading, and now wherever you buy an electronic cigarette battery or an electronic cigarette atomizer, it fits together, which opens the market to very stiff competition. And it did create a myriad of 1,001 supply chains, going from the one-man band in his cottage industry making batteries in his back kitchen to multinational e-cig manufacturers and everything in between, and just try regulate that one. Put a blanket ban on 1,001 different supply chains. It's gonna be a heck of a job. I remember when I was in the European Parliament, when the TPD was voted, that Commissioner Borg gave a speech to the parliamentarians, and he said, it's the Wild West out there. Exactly. I had a big smile on my face, and I said, exactly, that was the purpose. And the same thing we did with liquids. We switched from closed cartridges to open cartridges. The closed cartridge, if you buy a starter set from brand A, you have to buy the liquid in closed cartridge from brand A. What we did said, well, it's non-refillable, but we're going to refill them anyhow. And we found ways by hacking them that we could refill them with the liquid of our own. So There was no use any longer for the Chinese manufacturers to protect their little niche market, so they start making open systems because that is what the consumers wanted. And then, okay, another difference between first and second generation cigarettes, we improved on the quality of the product, and basically the biggest improvement was to make bigger batteries that do no longer have the size of a cigarette. Those batteries are not suitable to vape on. You need bigger batteries, it's just basic physics. So that's what we did, and the manufacturers followed. So the second generation, it actually was designed, and that is a completely different design goal, to open the market up to competition. And that worked pretty well. If you look now at what the worldwide, on all the different supply chains you can choose from to get your batteries, to get your atomizers, to get your liquids, well, good luck trying to regulate that one in a very restrictive way. It's not going to work. So here we come, and this is basically, I think, the main reason why many smokers have switched to vaping. It's to get rid of Nurse Ratchet. For those who do not know who Nurse Ratchet is, Nurse Ratchet is the incompassionate, sadistic nurse from One Flew Over the Cuckoo's Nest. And we are sick and tired of her. So what can we do to get rid of her? Well, if she puts access regulations on equipment, on juices, well, we have our mods, we have our open tanks. We can buy them from very small companies that work under the radar, that cannot be regulated. So good luck with it. If vaping bans are installed, like in this place, we just do not care. We vape anyhow. But we switch to stealth vaping, which is a breathing technique, so you do not produce any visual vapor. And if nobody sees it, nobody is bothered by it, and nobody is gonna ban you from it. That's what all the vapers have been doing here in this room today. They have been stealth vaping. Access taxation, oh yeah, smack a tax on nicotine. There's so many different supply chains where we can get nicotine without taxation. Nicotine has a lot of uses, and they can't put a general tax on nicotine on it. They only have to put a tax on recreational nicotine. And that's something else we did. That's colleagues of mine who are more in a chemical background. It's decomposed the liquids into its basic compounds, and now we can make our own liquids in our kitchen. It's very easy to do. It's just mixing up the basic component, which is PG and VG, with some nicotine and some flavoring. You just need to know what the proportions are, but anyone can do it. And all those different ingredients you can get tax-free. So if you slap a decent tax on it, I promise you, a lot of people who now are buying their liquids from manufacturers will start producing them themselves in their kitchens. With all the risks involved, of course. But you got rid of Nurse Ratchet. So that is basically the message that I want to give today to smokers and vapers, is make your lifestyle choices yourself, and you will do a lot better job, I promise you, than public health, than the World Health Organization, than the Framework Convention, the Framework Convention of Tobacco Control, and the whole lot. You will do a lot better job taking care of yourself than Nurse Ratchet taking care of you. And I think our biggest weapon in this is finance. Do not pay the intended taxes. And if they no longer get paid to regulate and over-regulate, they will stop. They will run out of funds. That is our biggest arm, I think, our biggest weapon. Yeah, final slide. So the second generation, it did plant some seeds. And from those seeds, there is a whole grassroots movement that emerged from it. It was not planned, and it worked much better than we could dream of. Vaping, it has become a little bit of a subculture. We feel united. I think maybe in this country it is a little bit different, but in France, if I walk into another vapor just passing by, I have to just to do a hand check, and a hand check that is basically I show you mine and you show me yours. And we feel connected. We do not have to speak a word. We are in the same situation. We are facing the same problems. We are connected. We are brothers and sisters. We are helping each other. And we do not need Nurse Ratchet any longer. We are free of her. So I'm going to conclude here.